Joining us now is Mayor Frank Scott Jr. of Little Rock, Arkansas. The county of Pulaski, where Little Rock is located, has 377 confirmed cases and 12 deaths. We're sorry for your loss and thankful that you're with us, Mayor.
Well, thank you so much, Poppy and Jim. I really do appreciate your kind words towards the city of Little Rock and the state of Arkansas.
Of course. If we could just begin with this, you were banned by the governor, by Asa Hutchinson, from making your own decision. You couldn't put a quarantine order in. You could put some things like a curfew, which you did, but you couldn't say that there was a shelter-in-place or stay-at-home order for the entire city. Do you think that cost lives in Little Rock?
Well, one of the main things that we want to ensure is that we always are doing whatever we can to protect lives. Governor Hutchinson and I have a great partnership and trust. We understand the reason why he made certain restrictions as it relates to commerce. But in the midst of that, we were able to be creative to protect lives by instituting our curfews as well as other laws in place to protect lives and slow the community spread. And we've seen, because of those early and aggressive actions, that we have saved lives in the city of Little Rock, and we're grateful for that.
So what does it mean now then, Mayor, if you saved lives with those restrictions, if every doctor we talk to, if the president's own health advisors say this, Dr. Anthony Fauci was on the air again this morning saying the same thing, that you need broad-based testing to safely reopen, and communities like yours don't yet have broad-based testing, are these decisions to reopen now premature, and will they cost lives?
Well, what we understand right now, as we here in the state of Arkansas are looking to reopen, we're going to be guided by our healthcare professionals and experts. We're starting to have more meetings as it relates to what that looks like in a very gradual, phased-in approach. But I can assure you, any decision is going to be made. The Arkansans and the Little Rockians are going to be put first in their health and safety and welfare. And so, again, we're being guided by our healthcare experts and really appreciative of our COVID-19 healthcare task force in Little Rock, as well as those that are part of the state of Arkansas's reopening task force that will be listening to these healthcare efforts as we continue to find more testing efforts as well.
Part of the lifeblood of every city and town, large and small, is small businesses. We know that. And the fund to help keep them open is out of money. Hopefully it will be refunded this week. That's what it sounds like, maybe even an agreement today. But I just wonder if you've had the experience in Little Rock over the last few weeks that some of the bigger companies got these PPP loans and not some of the smallest businesses that need them. I mean, I just, have heard so many stories in the last 3 days from, friends and, doctors' offices here in New York that just couldn't access the money.
Well, I can assure you here in Arkansas, me being a former banker myself, still in tune with the banking community and economic all over here in the state of Arkansas, I understand that our bankers have been on the front lines ensuring that we get the PP loans out as quick, fast, and in a hurry. And it's really going to a lot of the different small businesses, because here in Arkansas, small businesses are the true backbone and lifeblood of Arkansas's economy. We definitely need to continue to work with our federal delegation to ensure that we re-up on the PP loans, but also focus on how do we diversify those PP loans, because there are a lot of individuals that have businesses that aren't the traditional bank type of customer, and so really going to the gig economy for our barbers, our beauty salons, our nail salons, things of that nature. The average lawn person isn't necessarily going to a banker, but still is feeling the effects of the economy right now.
Yeah, and businesses that don't have those relationships, they're the ones who seem to be getting trouble getting those loans. I just want to ask you, Mayor, because I've been asking every local and state official this question, does your community have the testing capacity you need to reopen? It's already being discussed now. Can the people who need tests get those tests today, next week?
Well, here in Little Rock, we have continued to see our testing capacity surge. We're actually working with a number of our private sector partners that as early as this week, we're going to have even more of a surge capacity in the testing efforts. Clearly, testing is key as we make decisions on to reopening. And so there's always room for improvement, but we see a lot of great opportunity and improvement right here in Little Rock and Arkansas. And we're grateful to the state and what they've done to ensure that we have more testing available, as well as the University of Arkansas Medical Sciences.